Hi, did you know how the routine safety checks in psych wards might inversely affect the quality of care experience for both patients and clinicians? Here, we explore new technologies to reduce this burden. According to the American Psychiatric Nurses Association, there are multiple protocols in psychiatric wards to ensure that the patients are safe and their environment is free of harmful items. These routine checks are more crucial when the target patients also suffer from some cardiac or respiratory disease. Current protocols to monitor the high-risk patients at psychiatric hospitals require a staff member to enter each room every 15 minutes, to put a light on each patient to visually ensure that they are still alive and breathing. This protocol was meant for fast intervention to save lives, but unfortunately, it is disruptive to the patients and also is a burden for care providers. When psychiatrists at the University of Missouri reached out to us, we suggested a non-wearable and non-invasive radar system. We teamed up with Nokia Bell Labs to use a commercial ultra-wideband radar from the yard. We hide the radar system above each bed and inside the ceiling and recorded information at the rate of 10 frames per second. Then, in a post-processing step, 3D imagery of the area of interest is constructed. By changing the configurations, we could move from a low-resolution coverage of the entire room to a high-resolution coverage of small regions of interest such as chest or abdomen area, where most of the respiratory movements of the body appear due to the movement of the chest rib cage or diaphragm. After zooming on the predefined areas, we computed the interframe energy deviation to calculate a signal, which looks very similar to the reference signal from the chest band. We recruited 14 volunteers and asked them to wear the chest band and lay on the bed to perform a simple respiratory maneuver. In order to simulate the episodes of respiratory arrest, the participants were asked to hold their breath for a few seconds. Our recorded radar waveforms not only show the inhale and exhale patterns, but more importantly, the hold breath episodes are clearly distinguishable and match the reference respiratory arrest timing. We also asked the participants to repeat the maneuver once on each side, including left and right shoulder, supine and prone postures. We then post-processed the radar data to zoom in 3 areas to compare the abdomen and chest movements. The overall percentage error are as low as 4% for the supine posture, which is just 0.6 beats per minute error compared to the reference signal. To sum it up, this paper presents the application of ultra-wideband radar systems in monitoring psychiatric patients for adverse events of complete respiratory cessation. We proposed 3D reconstruction of specific regions of interest to detect episodes of hold breath, and also estimated the respiratory rate with an accuracy of up to 96%. We plan also to utilize this work in predicting sleep stages and assessing the sleep quality. Thank you all for your time and attention, and please share with us your questions, comments, and suggestions for future work. My name is Moein Enayati. I recently joined Mayo Clinic, and this work was the result of a short-term collaboration between our Center for Elder Care and Rehabilitation Technology at MU and Nokia Bell Labs during my PhD studies under supervision of Dr. Marjorie Skubic. Thanks again.